Think Pharmacy is a special showcasing event. It is being hosted by Community Pharmacy Wessex, and what we're hoping to do is show to all the key stakeholders the valuable contributions that community pharmacy can make to the people of Hampshire. Think Pharmacy will bring together all those people who are involved in making commissioning decisions locally, and also those who have influence over the commissioning of services locally, so that we can show them and tell them what it is that community pharmacy does. We hope that by bringing them all together under one roof, it's convenient, it's accessible for people, and we can also provide some on-site demonstrations so they can really get a feel for what it is that community pharmacy offers. We have included an exhibition hall that has stands that demonstrates all the services that community pharmacy offers, both those that are already being commissioned and working really well locally, also those that could be more extensively commissioned to help more people within Hampshire, and also some really new and innovative ones so that we can start some conversations about how we can change the way that we work. We've also got 3 very distinguished speakers to give 3 fantastic presentations.
There's an enormous amount more that is possible if we really start to think about what the role of the community pharmacist is in the community, how they can work with patients, and how we can build on that to help reduce burdens on healthcare systems and social services systems. So an enormous amount, I think, that creates that third pillar and that can really start to shift delivery of care. But it's not, as everything has challenges, and to move from a vision to a reality, I think is difficult. A lot of this, because of the new commissioning environment, has to be seeded at local level. And so for me, I think there are a number of key challenges we need to address. First of all, we have to ensure that we can work to establish effective partnership working between general practice and local authorities and community pharmacies. We have to make sure that there is that partnership and that communication to try to say, let's look at the problems, let's look at your priorities as a local authority, as a CCG, and look to how pharmacy may be able to help.
So we found it enormously interesting.
Yeah, it's hugely interesting because I think that we have come to a point with the NHS, as Sue was saying, that it's time to diversify a bit and to share out the patient, where the patients go for advice.
Given the significant changes that have taken place in the NHS structure locally, Community Pharmacy Wessex felt this was a really good, opportune time to start to engage with stakeholders, some old, some new, but to do so in a really effective and meaningful way.
It's been a great day. We've had lots and lots of people here, and what's been great has been the enthusiasm from the commissioners about what community pharmacy can deliver. It's been a split of about 50-50, those that are using the services of community pharmacy and talking about how good it's worked and how well patients and customers and the population has used their services and found them effective. But the other half have been people that are coming interested in using community pharmacy, utilising their skills and their accessibility in the high street. And what's been really good is that we've had evidence that's been collected locally and nationally to actually prove to them that this is an effective solution for their healthcare and their public health problems.
Yeah, it's been really interesting. I didn't know a lot of the services that are being offered here, so it's been interesting learning what pharmacy can actually do, which I didn't realise. I work in a team that looks at keeping older people independent, so I'm very much interested in how the pharmacies can help me get my message across to older people.
For me, it's a brilliant way of really focusing people's minds on what pharmacy can do, both within its core role in terms of supporting people with medication, but also in building awareness that you've got this massive untapped resource in community pharmacy. We've got an NHS that has got a massive funding crisis coming up, and using pharmacies properly can work for patients, can work for communities, and can work for pharmacy itself. So I think it's a tremendous event, and really, really impressed with the number of people who turned up.
In Portsmouth, we went about developing community pharmacy services so that they did at least contribute to the very significant challenge we have around tackling the health inequalities in Portsmouth.
So for me, what a brilliant way for the LPC to get people together and really start to promote community pharmacy and build those new relationships.
I think the really interesting thing for me has been how the exhibition bit has also worked. So we've got energy, we've got pharmacy teams here, we've got LPC members leading stands. I think it's been a real team effort. The world has suddenly changed. So instead of it being the old relationships between LPCs and maybe the NHS in one local format, we've now got clinical commissioning groups, we've got health and wellbeing boards, we've got directors of public health, we've got NHS England. I'm not sure we've got anybody in the room today from a commissioning support unit. We've got local education and training boards, we've got academic health science networks. My goodness me, locally, the challenges that community pharmacies facing in not only in identifying who all these people are, but then in engaging with them and really developing along the lines of a key word that we've heard today from all the speakers, I think, partnership. So the challenge now is to not only identify who's out there who can make a difference, but how do we link to them? How can we work together? How do we maybe, even as community pharmacy, bring some of those groups together so that between us we can think about how we might change things for our community.
So David Nicholson, when he was Chief Executive of the NHS, said that the NHS changes are so big they can be seen from outer space. What I kind of want you to realise is your partners have changed and they're going through quite a lot of ordeal through that. And your public health partners are now part of a new system for England, which starts off with local leadership moving from the NHS to local authorities, so services are shaped by local needs. And then actually it's not only one partner, there's another partner in public health which is significant, and that is NHS, Public Health England. And then there's another part of the public health definition that talks about the organised efforts of society. And that's really what it's kind of all about. It won't happen through single efforts. Single initiatives are important, but a lot of it happens not by chance, but by organised efforts of societies. So when you start putting words together like community, pharmacy, practice, public health, we need to understand something about our partners and agree what we want to do together.
It's been a really good opportunity to kind of come back to basics, thinking about community pharmacy in the round, and from a public health background it's really, really helpful. And I'm interested in how we can work with pharmacies on perhaps place-based solutions. I work in Southampton City, and perhaps thinking about how we can have a closer dialogue with the community pharmacist and their team around some of the work we might be doing with children's services, with some of our public health programmes, with the elected members potentially within an area to think about solutions for health improvement.
I think one of the challenges may well be communicating with the public and getting them on board. And I'd like to hear more about how pharmacies are going to tackle that. If you think about how pharmacies are interacted with in the continent, and how people use them there, I think we still have a way to go to sell what pharmacies can do to the general public, and that's a big challenge.
This is the third or fourth of these that's been done nationally. I would heartily recommend people think about doing this, maybe buddying up with neighbouring LPCs to put one of these together and think it through, learn from people who've done it already, contact those who've already run one, because I think this has been a real opportunity, with commissioners of all types and shapes and sizes, a real opportunity to get the message over. And this has been an event where we've been able to engage with all those kinds of people in one space and get them talking to each other as well as us talking to them.